Hey, Corner crew, it is Christina and Cindy, and it is time for another episode of Rolling with Ruby. Cindy, this is episode 12.
Wow.
I know,
12.
right? I know. So, just to give you an idea, Cindy and I are rehabilitation therapists. Cindy's a physical therapist, I'm a speech therapist. Cindy was in home health for how many years, Cindy?
Majority of probably 30 plus years.
30 plus years.
Yes.
Okay. So, and I did a stint in home health as well. The majority of my career has been in long-term care, but I did do a couple of years in home health. So we came up with some questions that we felt would be important for a caregiver to ask their loved one, important for their caregiver to ask the doctor,
Right.
not their loved one.
No, not their loved one, but the doctor or the facility that
Right.
they're being discharged from. Yes.
Absolutely, yeah. Before you come pick up your loved one from
Yes.
the healthcare facility. So we wrote those down. There's 9 questions, and if you subscribers to our caregiver resource library, our videos in our caregiver resource library, they have access to that as well. But I think what we're going to do is we're going to go ahead and put that in the comments section below. We'll put a link to it. So that you guys can have it, so that whenever you go to pick up a loved one, or if you know somebody that's going to pick a loved one up from a healthcare facility, you can ask these questions, and it will really help bridge that gap that's created when you bring home your loved one from a healthcare facility.
And these, of course, are not all inclusive.
They're not.
Just, some of them that we wrote down that we thought were important.
Yeah, things that we feel were important and stuff. So when a loved one goes to a healthcare facility, they get all kinds of skilled care, nursing, therapy, stuff like that. And so then when they come home, when you have to go pick them up and bring them home, that almost that level of skilled care falls on you, the family caregiver.
Right.
So Cindy and I created this video library to try to bridge that gap so that we can help you guys understand how we give care and how we train the family caregivers to give safe care when they bring their loved ones home from the hospital or from a rehab facility or a nursing home.
Mm-hmm.
So we'll go ahead and get started.
Yes.
Are you ready?
Ready.
Okay. So number 1 is, does the patient need someone to stay with them for now?
Right.
So explain that.
You always want to ask, what kind of care, do they need 24-hour care?
Okay.
Are they not safe to be by themselves at any point in time when they're home? Can they be left alone a few hours at a time? So you kind of want to know what the recommendation is as far as, do they need somebody there to stay with them? Because, I've had people that have had like total joint surgeries. Some of them are planning on going home alone, which is kind of rough, So you do definitely want to ask that question.
Okay, great. All right, question number 2 is, does the patient need someone to assist them when they are up in their walker, on their walker, or maybe in a wheelchair?
Right.
Some kind of mobility device.
Yeah. So a lot of times, there's varying degrees to how much assistance somebody may need when they're up due to safety.
Yeah.
And sometimes there are people that may come out of the hospital or rehab, and they're okay to walk on their own with their walker. They're safe. They're not a high fall risk as long as they have their walker. Sometimes people may need what we call standby assistance or contact guard assistance, meaning they need somebody right there. Contact guard, they need somebody touching them, preferably with a gait belt, so that they have a hand on them in case they lose their balance.
Okay.
So it's good to know how much assistance. Some people may be coming home. I hope not.
Yeah.
But some people may be coming home needing assistance getting up out of a chair.
Okay.
And how much assistance is that going to be? Am I going to, as the caregiver, need to give them a little bit of assistance, middle of the road, 50% assistance, or are they going to need a lot of help?
Yeah, and chances are they've been working with a therapist, whether it's in the hospital or at a rehab facility, obviously, or a nursing home.
Right.
So probably checking with the therapist directly would probably be the best, you get the best answer, the most precise answer from the therapist. Okay. Number 3 is, do we need a gait belt? That's important.
Yeah, very important, very important. And I'm a big proponent of that, especially when someone is first getting home. I probably use caution or error on the cautious side. But it's good to have a gait belt, especially if somebody is going to need a little bit of assistance, contact guard assistance, if their balance is bad, if they're still fairly weak, then I would recommend a gait belt when they are up.
Okay. Sometimes your loved one will come home with a gait belt.
Yes.
Especially if they're coming home from a rehab facility and they might need that.
Right.
They might, and the therapist knows that they need a gait belt, so they'll usually send a gait belt home with.
And I would ask for one.
Yeah. Why not? Right.
Why not?
Absolutely. Okay. So Cindy and I are talking about questions that we think are important for loved ones to ask the hospital, nursing home, healthcare facility, rehab facility, before you bring your loved one home, just so that you know kind of where they're at as far as need for assistance and what kind of assistance you're going to need to provide for them. So we are on question number 4, and that is, does the patient have any restrictions or precautions regarding getting up or moving around?
Right. So you want to ask if there are any restrictions, especially if there's been some type of a surgery, some type of an injury. Sometimes the doctor will put restrictions. For example, if they've had a hip replacement, there's going to be some movement restrictions of that hip.
Right.
If they've had a back surgery, there's certainly going to be some movement restrictions as far as bending and lifting and twisting and things like that.
Okay.
So you always want to know, is there any precaution or restriction that we should be watching for and adhering to with the person that's coming home.
Great. All right. Question number 5. Be sure to review with the physical therapist how to get the patient safely into the home. That, I think, is huge.
Yes.
You get your loved one from the facility and you bring them home.
Right.
You get them out of the car, but maybe you got a couple of steps to get into it.
Right. So you want to review, and usually they typically do that, but you want to kind of know and let them know what entry you have or what entries you have into your home, and they'll help you figure out which way would probably be the best, and they're going to give you the techniques to get that person into the house, whether it's sometimes if there's just like 1 or 2 steps, we may actually have the person go up backwards and push themselves up with the walker. I know that sounds strange, but once you're trained on it, it's actually much easier than trying to take them up forward.
Easier for everybody.
Everybody, especially if they have some kind of a weight-bearing restriction on a leg or something like that.
Yeah.
But yeah, the therapist can certainly help you figure out what's the best way to get them into the home.
Okay. All right, question number 6. If the patient is dealing with pain, ask if pain medication can be administered just before leaving the hospital. I think that one is huge, and I think it's probably one of the best pieces of advice that we usually give people.
Right. Because time and time again, especially after a surgery or something like that, if you miss that window, sometimes the discharge process may take a little bit longer than expected. By the time you get them discharged, get them in the car, get them home, and then most of the time you come home with a prescription that you then have to go to the drugstore to get filled.
Yeah.
That sometimes can get delayed, and there are times that the loved one can get behind in their pain.
Right.
And so if they have been on a pain medication regimen, talk to nursing, work with them, and see if something can't be given or timed to be given right before they leave, so that you don't have that gap, because that can make the first night absolutely miserable for everybody.
Yeah. That's such a great piece of advice. All right, before we move on to number 7, Cindy is a physical therapist. I'm a speech therapist. We are Adaptive Equipment and Caregiving Corner. We make videos to show people how to stay safely in place, to stay aged safely at home or in their home. So, and then also show caregivers how to give safe care, keep themselves safe also. And then we also raise people's awareness of products that we have found. So companies will send us their products, we'll make videos and put it on our YouTube channel. So now, Cindy, the last 3 questions. Number 7 is, if the client has a walker, remember to bring it on discharge day if needed.
Yeah. So if they've been on a walker,
Mm-hmm.
it might be a good idea to just bring it up with you to the
Mm-hmm.
hospital. Make sure that they have one.
Mm-hmm.
Therapy can do that.
Yeah.
But it would maybe be nice to, when you pull up at home, you have it. It's right there in the house. You don't have to leave the person in the car, run in the house, get the walker.
Yeah.
So just having it, if that's what they're using and that's what they're needing to get out of the car with,
Yeah.
just have that piece of equipment with you.
Yeah. Too, is even having a spare one. If you
Right.
go to find a lending closet,
Right.
a local lending closet, and see if they have a spare standard walker that they could loan you. That way you could leave the one you have at home and then take that spare one with you, or whatever, vice versa even. So
Right.
make sure to check out your local lending closet and see if you could if they could loan you an additional walker. So all right, so that's number 7. Number 8, did the patient start exercises, and if so, ask for a copy of the instructions.
Yes, because if they have been exercising at the facility, you certainly want to continue with those exercises when you're home.
Okay.
You want to ask about what they've been doing, how many repetitions have they been doing. Ask for, like you said, handouts, so that we can keep that strengthening up and continue with that strengthening when they get home.
That's excellent. Okay. Let's see. Number 8. Did the patient? I already just said that one.
Oh. We're going to repeat number 8. Let's try number 9.
Yeah. Let's do number 9. Yeah.
Okay.
So that's the last one. Okay. Yeah. Number 9. Does the patient have hip precautions?
Number 9, does the patient have hip precautions? That's another one that we want to just make sure. Again, really any surgery, you want to make sure on precautions. And hip precautions can be sometimes tricky. You want to make sure of what type of hip surgery they got. And you want to make sure that those precautions, so that you're not, that's a delicate time after any surgery, back surgery, knee, hip, ankle, whatever it is, shoulder. So you want to know what those restrictions are, what they can and can't do as far as when they get home, to make sure that they are being very careful with that surgery.
All right.
And Christina, I thought of one more thing. I thought it was on there, but I just want to reiterate this too. We talked about exercise and what was our loved one exercising. That includes walking as well, because if they were walking the facility, and a lot of times with home health, I realized this over the years. A lot of times in the facility, they want them up and walking. So they may be walking those long hallways in the rehab or in the hospital. We're talking 150, 200 feet, sometimes more than that. And we don't want our loved one, if they're able to do that, we don't want them to come home. And of course, our houses are going to be smaller. You're not going to have that kind of walking. But we want to find a path for them, and we want to keep up that same amount of walking and gradually increase that. Again, depending on who it is and what their activity level is. Right. But we don't want them to go backwards when they come home.
Absolutely.
And a lot of
the wrong way.
And a lot of times as caregivers, when we get them home, we want to sit them down and we want to protect them and we want to do everything for them. And sometimes that can be the worst thing.
Absolutely.
For them. So we need to find those things out, have a good balance, so that they continue to progress. And
it just helps with their functional independence and their dignity, ultimately.
Absolutely.
I think so. That's really great. So Cindy and I have been talking about discharge questions to ask your physical therapist, speech therapist, occupational therapist, nurse, doctor, anything when you go pick up your loved one from a healthcare facility, to ask these questions. Just because we think it'll help make that a smoother transition back to the home. So like I said before, we will put a copy of this in a link below. So please check it out. If you know anybody that could use it, print it off for them and give it to them, or just give them a copy of this video. Yeah.
That'd be great.
Absolutely. So I think that's all we had for today. So episode 12, Rollin with Ruby. And if you guys have any questions, engage with the video. We'd be happy to answer them. We're pretty good about answering questions. So
we try.
We do try. We do try. We try to be prompt about it. So anyway, so that's all we had for today, and we will see you in the next video.